I am a school board member at my son's school and have been trying to start a discussion about the indoor requirement of masks on children. The rest of the board would like me to present information as to why mask mandates for kids should be dropped. Having previously had state and federal training for hazmat and bioweapons emergency response, I plan on bringing up improper mask care, fit, micron sizes, along with a mortality rate for young children. Do you have any additional information that could help strengthen my position in my upcoming school board meeting? I guess improper mask care, fit, micron sizes, mortality rate for young children, all true and good. One obvious thing that I would add is that we are absolutely 100% affecting these children's development and ability to recognize, interpret, make sense of, and indeed learn how to convey meaning with their facial expressions, which is utterly important to learning how to be a human being. That this is affecting social and therefore psychological and therefore mental development. And at a critical age, and especially given that many in a place where there's mask mandates on school children, presumably other things are also still curtailed. So school is so much of where kids are getting a lot of their social interactions, and not being able to see each other is going to have long-term effects down the road. And no, it may not be trackable to this because it's one of these dispersed long-term effects.
Yeah, I would say that this really is the answer. That we are in exactly the wrong position trying to argue that they don't work, because then if they worked a tiny bit, which they probably do, right, then there's an argument. But the point is actually, no, it's not worth it. This isn't that kids masked for a month, right, to get us through whatever it was. We're now talking about years of development in which one of the most unique features of human beings, our facial expressions and our ability to convey things with them, are being denied them during a developmentally critical period. And so at some level, the answer is, even there is precious little evidence that kids are a strong contributor epidemiologically, that they are transmitting lots of disease. But even if they were transmitting lots of disease, or a certain amount of disease, and even though that does imply that some old and infirm people are likely to succumb to a disease that will ultimately have passed through a child somewhere, children are entitled to that which they need, right? We consider it child abuse to deny a child access to the world, to leave a child locked in a room. This is something like that. This is denying them something fundamentally human, and it's not temporary. That's the point. When does this end? They will not tell us. Exactly. So this is not based on science, and the harm is quite obvious. And frankly, it's time for us to stand up for children, both with respect to vaccines that do not serve them medically, that the best argument for them is that it protects others, but we don't sacrifice children to protect others. That's not who we are, right? And this is that same theme, right? They are entitled to a proper developmental environment, and this isn't a temporary disruption of it. So it's enough already.
I will just add, I don't have time to pull it up now, but I'm remembering a graphic showing the number and intricacy of facial muscles in, I think, maybe a rhesus macaque, some old world monkey to which we are somewhat distantly related, more closely related than we are to a cedar tree, less so than to an orangutan. And the facial muscles, their number and intricacy in a human. And, when you say, Brett, that facial expressions is a big part of how it is that we communicate, this is actually one of the things that makes us distinctly human. There are, of course, many, many things, and there's been much ink spilled over what is the one thing that makes us human. And, down that road, nothing really interesting happens because it's not one thing. But the fact that we can communicate so much more with our faces than even our closest relatives can also tells you something about how much we use that and how much we need it.